Hey,
Hi
w-
there.
welcome. Hey, happy Tuesday. How's dinner?
I'm good over here in Missouri, St. Louis. How are you out there?
I'm doing great. I'm doing great. The weather's getting nice and chilly.
Yes, it is.
Yeah, so we're just kind of settling in, getting our coats out here in North Carolina, feeling very good. Yeah, this is just an amazing time. I'm so thankful that you've taken the time to kind of join me, to join Betsy and myself, for all of you guys who have taken this moment to invest in your own health and getting better day by day. So, we want to kind of talk about, not just health topics, but we also want to talk about some troubleshooting points that we all kind of have. Some of those aspects that are old myths that we all kind of live with, that become habits, that become lifestyles, and how those things can sometimes hold us back from really achieving our best. So with that being said, Betsy, I'd love for you to kind of get a nice introduction for any of those who don't know you. I'm sure everybody does know you and love you.
Well, thank you. Well, first of all, I want to say hello. And if anybody's out there who I do meet with weekly, I think you could say hi to me in the chat. Let me know you're here. And thank you, everybody, for joining. And if I don't know you, I would love to meet everybody. I'm the nutritional health coach, and I meet with people week to week. Some people I meet every other week. Some people do once a month touch in. I always say what I love about Goal.MD when I'm meeting people is that we all know the medicine is a great tool, but it's also learning about nutrition and lifestyle. So I love that we get to do both and that we offer both. And I always tell people there's no rules to meet with me. So whatever works, I want people to know that's what I'm here. In terms of some people, like I said, meet with me weekly or whatever. So anyway, so that's me. And I love to share information, and whether it's handouts or struggles or talking about side effects, whatever it is, that's what I'm here for. So, anyway, thanks for joining.
That's great. That's great. I feel like I have the easy job sometimes of just kind of getting people started on the medication, and you have the hard job of helping them to, carry the load, figure out what works for them, and kind of deal with all the things that go on. So, Bessie, thank you so much for all that you do.
You're welcome.
Yeah. So, let's kind of hop right into it. We're here at Goal.MD. We have so much to offer as far as, improving overall, just our lifestyle, just kind of restoring or trying to turn back the clock. Um, at first started off with aspects of weight. And then we can also go into the aspects of energy and, just restoring even hormone balance. And really, that's what this really is, right? We're kind of trying to reestablish some balance between those hormones that help us to store fat and then those hormones that help us to get rid of fat, such as glucagon, or what we now kind of call the GLPs. So, Betsy, kind of tell us a little bit, kind of your take on some of these GLPs that people are using, or the two that we commonly offer here at Goal.MD.
Well, the biggest thing that the patients are on are the tirzepatide as well as the semaglutide, and both have their benefits. And I think that's where when they're talking with you to help figure out what will work best for each individual person.
Yeah, yeah, it makes a difference. Semaglutide, it's kind of was that first one that was out on the market. Some people have known that under other names, Ozempic and things of that nature, and then also Tirzepatide kind of later came to the market, and people have known that obviously as Mounjaro or Zepbound. But you're right, there are great tools that we can use, and usually what we like to kind of do is find the right balance between the message that, how much medication or how much dosage is right for you to get a nice consistent weight loss of about 2 to 3 pounds per week. So that's kind of what our goal is here by balancing out our insulin to glucagon ratio, for lack of a better word. Um, so when we kind of understand how we are losing weight or how can we lose weight, we kind of find ourselves kind of trying to always do the calories in and calories out. So with our semaglutide or our terzepatide, that really helps to find that right balance for us. So, but why do you feel like people sometimes, Betsy, kind of get to a point where they start hitting plateaus?
That's what I run into a lot. I meet with a lot of people who've maybe done really, really well, and then all of a sudden they hit a plateau. And I have to say, most people will at some point hit that plateau. Some people it might be for a couple weeks, some people it might be longer. And then when we start talking, um, we really find out when we take a look at what people are eating, in most cases, people are not eating enough. We
Mm,
think, and we grew up in the time, at least I did, where it was, and what seems to be logical is that if I eat less, I'm going to lose more. Like,
yeah.
that's logical. However, that's just not how it works. And so as we go through what a typical eating day, that's the biggest thing that I notice. I feel it's so weird as the health coach. I'm always like, eat more. You have to eat more. And the ahas that people see are just like, oh, you're right. I need to eat more. And then we
Yeah.
talk about what to eat. So that I think that's the biggest thing that I run into with people.
Yeah. I always kind of call it like a metabolic exhaustion. So, I mean, there's a couple times where we see patients kind of hit that plateau the most. So, there are a lot of our patients who have started off with their weight, in the high numbers, 200s, 300s, and they lose a significant amount of weight uh, early on, and then it starts to plateau off. And a lot of people get frustrated. They feel like, oh, now the medicine's not working. But really, a lot of times it's about kind of staying stable on the medication and letting your body kind of adjust into that new setting that is now kind of hovering in. This allows your thyroid, this allows other organs in your body to kind of catch up and to try to start having that balance, that hormone balance that we had kind of talked about earlier. Other aspects, just like you said, Betsy, it gets to a certain point again where we are starving ourselves. We all of us try to pride ourselves on being able to skip a meal and to decrease our quote unquote calories, but we end up also subtracting or decreasing our nutrients and those things that really help to keep the fire burning, help to keep the metabolism at its highest in order to continue to burn or shed off that next layer of tissue or fat tissue. What are other things that you feel like people need to do to kind of push through that plateau?
I think another big thing that, one of the conversations we always have is I always say, did the doctor tell you how much protein you should be eating? And they're like, yes. And they know what it is or they've forgotten. And then, I kind of share the average person. But I always say that if you're trying to meet that 90 to 100 grams of protein, wherever they might fall, you cannot reach that with one meal a day or two meal a day. And the biggest thing that I hear is no breakfast.
Yeah.
I don't have time for breakfast. I'm not hungry. I'm not a breakfast person, which I totally understand. However, you need to have those three balanced meals each day if you're going to get close, if you're at least going to get 90. So, again, how do you fit that in? Again, when the medicine's telling you you're not hungry, and I come in and say, but you have to eat, how do we find that balance? And so
Yeah.
that's something that we really talk about as well.
And I really find that a lot of people pride themselves on not being, I'm not a morning eater, right?
Yes.
Or I don't eat until a certain time, or I don't eat after a certain time. And a lot of people are very proud of that. And
Mhm.
again, I think that kind of goes to, again, some of these myths or these misnomers that we've kind of have, been taught in the past. And there's always change in science, and I think that's what we have to kind of give a little grace or forgiveness. Like, what my grandparents were taught may have been different than what my mother was taught, and what my mother and father were taught is different than what my sister and I grew up in. But that is a difficult, thing for us to kind of readjust when all of our lives we've been fed with the same mantra. And now that we're kind of going against, and now I'm supposed to eat breakfast,
Hmm.
I don't even know how to prepare a breakfast that gets me 30 grams of protein.
Right.
Yeah.
Right. And, some of those myths that we do talk about, because it is how you're growing up. We talk about the clean plate club. We talk about, we grew up with your protein, your starch, and your vegetable. And sometimes we talk about that. Guess what? You don't always need that starch. And it's a different way of looking at food, and looking at your plate, to get there.
Yeah. Yeah. Well, and that's the great part about coming on board with our team. Not only are we giving you medication, but we're giving you diet plans and tricks on how to achieve those goals that we help to set for you. Um, so with kind of going into that, are there ways that people can, so you had spoke about protein. Why is protein in your opinion such a important thing to take on? Because I mean, we all know high protein, low carb, right? Everybody can quote that like the back of their hand. But I guess the question is why high protein?
You know, a a couple of things that I share with people, and you'll be able to tell the inside part. But first of all, the easiest one is that it makes you full. It just helps keep you fuller during the day. Um, and just again, too, I know we talk. I always say too, it's like protein, protein, protein is the buzzword right now out there, but it really does work. Um, Even personally, I've changed, just in my personal, what my day looks like and how I get the protein in. And it does. You just feel better. You feel more full. Your cravings aren't there because your body is getting what it needs. And then in terms of, I always talk to my older women because as women, not even older, just as women, as we're getting older, we're losing muscle. And
Yeah,
so the protein is going to you know, help us hold on to that muscle and build it. And we talk about ways of that.
yeah. I think it's very important from and I'll kind of geek out here from a medical standpoint.
Yes. You're much better at that.
But th- I don't know if you know, but it's difficult to starve away fat. Like, when we go into fasting periods and we essentially starve ourselves, well, we've come a long way with being able to have machinery and lab testing to actually tell us what is happening in those time periods. And you'll hear a lot of people talk about, well, if you fast long enough, your body will reset itself, and you could activate stem cells and things of that nature. And sure, that's a exaggerated benefit of fasting for periods of time. But what we kind of have are these moments when we're kind of going more than 5 hours without eating. Like, for example, we slept all night long, we're starting to wake up, and now we're going 3, 4, 5 hours without eating, and we think that our bodies are consuming the fuel from inside, and that's true. But when you have a choice, when your body has a choice between breaking down fat and breaking down muscle, the body chooses not to break down fat because organs such as your brain are made out of fat. So one of the things that your body wants to spare is brain tissue, is organ tissue. And organ tissue is generally made of fat type of material, not muscular material. So it's more easily and more readily available for your body to destroy muscle mass when you're starving than for your body to destroy fat tissue. Matter of fact, just a quick science update here. The only thing that actually breaks down fat tissue is the muscle mass that lives right beside it. So it's kind of like a real estate game. Have more muscle, less
Mhm.
fat. You shrink the muscle by not feeding it, and it atrophies away, and the fat expands.
Who wants that?
So and again, the most important thing that your muscles need is not water, is not Pop Tarts, is not fruit, but is good old meat. And I know there are a lot of people out here that may be vegetarian, that may, not to light eat meat. Are there other options that people can go after to get, good sources of protein?
I mean, definitely you're going to get the most from your chicken, your beef, shrimp, seafood. One of the things that I hand out to people on our first meeting is what I call the protein reference guide, which lists all the different proteins and how many grams in each food item to kind of give you some ideas, give you some um, new things. And I mean, there's a long list. I mean, there's protein in even, legumes and beans and different things. But, it's finding how much do I have to have and where can I get it from to still get to that 100 grams. And I do always recommend, especially in the beginning, to track. You don't have to track your calories, you don't have to track what you're eating, but just track your protein so that you have an idea. Am I getting 50 grams a day? Am I getting 70 grams a day? Or am I reaching that goal of 90 to 100 or so grams per day? So,
And I bet you that gives you a lot of help when you have your meeting. So now, because now they've written down what they're eating, you can literally see, face to face and kind of point at, what do they like?
absolutely. And then kind of going back to your question, there are some easier tricks like with protein powder and protein drinks that kind of give you a big, a kick or jolt, or especially at something in the morning for on the run or trying to do quick. Um, so hopefully that answered more of your question of some other proteins besides meat.
Yeah, yeah. Well, it's always helpful. It's always helpful, and there's way more. So we'll save more for future videos. But let's kind of get right into the heart of it. Let's get right into the heart of the medication. The GLPs, so glucagon like peptides. So essentially, these are, hormones that man has kind of been able to formulate to be very similar to how the body's normal hormones respond as well. So semaglutide is, in my opinion, a very good medicine for helping people to push away from the table. So it really kind of helps to take down your appetite, keep you full longer, and just kind of make you feel satisfied for much longer time periods. And again, then those breakthrough cravings hopefully don't have room to exist. Are you kind of seeing the same thing, Betsy?
Oh, totally. I mean, the biggest thing that people say is that their sweet tooth has disappeared. Um, So yeah, definitely. And their their appetite, they're not having those cravings as they were. And it's just kind of astounding
Yeah.
for some people because they didn't think that was possible.
Yep. Yeah. I had one person tell me they noticed they could walk. A lot for many people they're working from home, so the refrigerator's right there. And somebody said I could actually walk past the kitchen and not kind of instinctively go in there because I was already so full.
Yeah.
But just like we have some people who are overeaters, myself, I consider myself to be an undereater. Like I will get so busy that I will like skip lunch, or again, like you said, sometimes I get so busy I skip breakfast. So in that case, I may not need to be so much pushed away from the food from the table, decreasing my calories. I need sometimes to just have my internal blood sugar more stable versus having these spikes up and down.
Mhm.
And in that case, I usually recommend the Tirzepatide. So the Tirzepatide, I have kind of found that semaglutide works great for about 80% of people who get started on it. And then there's some people who can't tolerate the side effects. Sometimes there's a little bit more issues on their stomach, and then they sometimes need a Tirzepatide, very rarely. But again, there is that certain group of patients who have really been trained to eat only once or twice a day and still don't understand why they're not losing weight.
Mhm. Yeah, I have to tell you, I had the best strategy that came from one of the patients that I was seeing who exactly what you just said. She was just not hungry and she could go all day without eating. And she
Hmm.
literally set her timer to go off to remind her to eat. And that was great. That worked for her because you have to eat.
Yeah. I think we have trained ourselves how not to hear ourselves when we're hungry,
Hmm.
right? I think, again, we have pride ourselves on being able to go, but this is not a normal physiological thing, right? So when people say, I'm not a morning person, I help to remind them where you were once upon a time when you were a baby. And now, as an adult, you've kind of trained yourself to skip certain meals, due to maybe your profession or whatnot. So you're right. Some people just need to set timers and eat because it's the right time and the right thing to do.
Hmm. Hmm. Um, do we have, I don't know, can we see, do we have people that have some questions for us on this topic? Tirzepatide, semaglutide. Oh, here we go. Can you see that? Yes, I don't know if I can say the name, but yes, I see a question. And the answer would be yes. Even on maintenance, you want to maintain that 90 to 100 grams of protein. All the all the behaviors and everything that you're learning while you are on the medication, this is the time where you're building these habits. And yes, so even once this is just becoming your new way of eating. So yes, all right, good. Thank you for that question. Do we have another one? I don't know where Dr. Fitch went. Are you
I'm
there?
here.
Okay, here's another one. Oh, this is a question for you, for sure.
I don't know what
You
happened
see
to my
that
camera,
one? Will
but I'm
steroids?
here.
I know I can't see you. Will
Hmm.
steroids help? Oh, it popped up and then my memory. Will steroids help build muscle? I think that's what the whole question was.
Yeah. Steroids. Will steroids
There you
help to
are.
build muscle?
There you go. Gain
Am I
muscle
there?
mass and muscles.
Yes. Yes. Steroids are amazing. Again, now there is the whole aspect of making sure that the diet is proper, because there's no reason to go to the gym and take all these extra, helpful hormones, if the diet's not right. But steroids are amazing. So we obviously have men and women who are approaching menopause and menopause, where our hormones, in our 18s were at their best, and we were able to build the best muscle mass during that time period. And as we have gotten older, due to diet, due to stress, and also a decreased amount of those hormones being produced, we've lost a lot of that muscle. So there are a lot of times when we want to kind of turn back the clock and to add some of those hormones back in. Matter of fact, we do a lot of that right here at Goal.MD. So if there's any coaching for hormone replacements or growth, Somorelin, or things of that nature, those are excellent additives to add on top of your GLP protocols.
Awesome. Good. Do we have another question? Is that where we're at? Any more questions? Just us. Oh, does the amount of calories protein change with the dosage?
Does the amount of calories, say it one more time, repeat the question?
Does the amount of calories and protein change with the dosage?
No, the calories and protein are based on you. Most of the time, they're based on your overall bone structure. So, probably the best way. So, calories is a difficult conversation to have. I mean, I think it is an older conversation to also have. So, even though calorie deficits, we've talked about that for many years and things of that nature. The more way that we're talking about diet and nutrition nowadays are through our macronutrients and our micronutrients. So calorie is just one factor. But when we kind of think about those macronutrients, our protein, our fats, and our carbohydrates, when we think about our protein, we really want to primarily focus on our lean muscle mass. And that's the ideal amount of muscle that you need to move the skeleton around. And that doesn't really change. So the first thing for most of us is to realize that we're really vastly underfeeding this muscle tissue or muscle system of ours, and still demanding that it does extra work. So for the most part, I would encourage that people try to, number one, get to a good goal. And once you've lost the weight, and you've hit your goal, if you want to kind of back off the protein, that's always an option.
All right. Anything else we'd like to talk about?
All right. So again, GLPs, amazing medication. Semaglutide, a great product to get started on if you never have been in the world of GLP medications. If you tried semaglutide and it's not working well for you, if you want to try Tirzepatide, that is available. We even have a synergy, which is a kind of a combination of both, right? You get the best of both worlds, but both that fullness appetite suppression along with that blood sugar stabilization. This is very good for those that really want to take a very strong approach at their weight loss, or have found that they're resistant to the singular medications beforehand. But that is a great conversation that myself and Betsy will have with you, and making sure that we're exhausting the other options before scaling you up. And that's a conversation that we all have together. Do we need to go up in medication? Do we need to take a break? Do we need to just adjust the diet? Other aspects in addition to the GLPs that will help to enhance not just overall weight loss, but energy. So along with weight usually comes people who have struggled with fatigue. We have amazing additive peptides such as our NAD line, which is 10 times better than that old B12. Again, very outdated science as compared to NADs and some of those other peptides that we have. There are a lot of restorative peptides that we also carry here at Goal.MD, such as our Sermorelin, our growth hormone release peptide, our testosterone, our BHRTs, and other ways of kind of doing that. So basically, sit down, let's have a conversation. Let's find out kind of where in this season of your life that you really feel like you're being held back, or you really want to have a breakthrough. And Betsy and I would be more than happy to kind of sit down and look at that and offer some of, not just one peptide, but maybe a good concert of an overall restorative protocol.
And I think what you're saying too, I know I talk to so many people that especially as we're getting older, it really changes to longevity. And that's really what becomes so important, is taking care of our health through these longevity options that you talked about, the GLP-1s, as well as we have great supplements. I know I can't live without my collagen every morning. So, like you said, these are all different things that we can talk about, and that we have and we offer. So, come and see us. If you haven't seen me and you're out there and you're currently on the program, come make an appointment with me. If you are interested, you'll talk to Dr. Fitch first, and let's get started. Let's make some changes. It is the perfect time of year to get extra support as we get through the holidays.
Yep. All right, guys. Well, this has been a wonderful series, and we're going to be coming back for more of these, right? So,
Yes.
so
Hope
if
you
you got
liked us.
if there's topics that you want to talk more on, give a few moments. Just go ahead and type in your chat something that you're interested in that maybe we didn't cover, or maybe we didn't cover enough. We got our team right now that are watching the chats, seeing what's kind of coming in. So go ahead and type in any interest that you may have. Hot flashes, low libido, decrease energy or decrease muscle tone, or how do I get that skin to snap back? So all of these are topics that we'll kind of bring to the forefront because really we have a solution for a lot of things that maybe you haven't heard about or been introducing your traditional search for these problems.
And we're getting a notice before we leave. We have a couple of questions we want to make sure that we answer. This one, I don't know if you can see this. Can you switch from tirzepatide to GLPs once you achieve your goal?
Yes. So there's a lot of ways that Tirzepatide is a GLP. I think so Tirzepatide is one GLP, and to answer the question, it's very easy to switch back and forth between semaglutide and Tirzepatide. Now they do act a little different, so you can't always expect a one-to-one ratio right between the medications. But we do have a lot of patients who, once they've lost their weight, they will talk with Betsy or myself or the rest of the team about how to get onto a maintenance plan that works great for them. And we do have both injectables and orals. A lot of people like the injectables during that initial weight loss phase, and then sometimes they'll go to the oral medications or stay with the injectables for just that ongoing maintenance.
How can some of these great items be sent to California?
Pigeons. Don't know. Yeah, there are some states. There are some states that are tricky, right? There are some states that are tricky to kind of work along with. So a lot of times we have to find a compound pharmacy or company that's already in your state, versus some of the other companies that we work with. So I'm sure we will definitely be able to kind of have an answer because we want to make sure that we're helping everyone.
Are the pills as good as the injectables?
Well, everything is great, but there are a little bit more um, complications with taking a pill versus an injectable. So the first thing that comes to my mind is compliance. Once a week injections is kind of hard to mess that up, right? So if Tuesday comes around and I forget to do it on Tuesday, I can always get my shot in on Wednesday. But when it comes to the pills, that's something that you need to make sure you're taking every day in order to keep that level up in your bloodstream. And I think a lot of times with the compliance of that, it does make that a little harder to reach the goals. Also, absorption. So oral medications sometimes are a little difficult to absorb, so it has to be done on an empty stomach with only one glass of water first thing in the morning. First is just the convenience of being able to do just a small itsy bitsy injection once a week.
All right. I think that's it. I think this is really it. Thank you for everybody who's joined us. And leave us, like Dr. Fitch said, anything you want to talk about. And I think we'll be back next Tuesday. I feel like we got a thing going here.
Yeah.
So to the question, how often are you going to have these? I think we're going to try and do them Tuesdays, 6:30 Central. So we'll hopefully pass more information on. Tell all your friends. And and come see us. See us both. We're here.
All right.
Thanks for joining. Good to see you.
Okay, guys. See ya. Great
Bye.
time. Bye.